Telehealth, connecting care through technology. We will be tackling what is telehealth, the benefits of telehealth, commonly used applications, and lastly, technological barriers and clinical limitations. So what is telehealth? Telehealth is a convenient way to receive healthcare services remotely using technology. It includes telemedicine, consultations via video or phone, remote patient monitoring, tracking health data like blood pressure and glucose levels from home. We also have e-visits, which are the online consultations for minor issues, and telepsychology, which are the online therapy sessions. Telehealth improves access to care, especially for those with limited mobility or in remote areas.
Benefits of telehealth. Telehealth offers several key benefits, including increased access to healthcare, improved convenience, and enhanced care. It eliminates geographical barriers, allowing patients in remote areas to consult doctors without long travel times. It also provides flexibility, enabling patients to schedule virtual appointments at their convenience. Additionally, telehealth enhances chronic disease management and facilitates quicker access to specialists, improving overall patient care.
Next is the commonly used telehealth applications. First is the video conferencing platforms. It enables real-time virtual appointments where providers can assess patients, discuss medical history, and provide treatment. Examples are a dermatologist examines a skin condition via Zoom, a therapist conducts a session using Google Meet, and a physician performs a follow-up via Skype. Next is the telehealth-specific platforms. It is designed for healthcare, offers secure messaging, EHR integration, and video conferencing. Examples are Amwell, branded telehealth services for hospital, Doximity, a collaboration platform with telehealth features, and Teladoc, on-demand virtual doctor visits. Next is the messaging apps. Secure text-based communication for non-urgent matters, improving patient engagement. Examples are a patient asks about medication side effects, a nurse sends post-operative instructions, and the patient shares a wound image with their doctors. And then lastly, the remote patient monitoring devices. It collects and transmits health data for continuous monitoring. Examples are wearable trackers to monitor heart rate, Bluetooth blood pressure cuff syncs with the EHRs, and then continuous glucose monitors send real-time data to doctors.
Besides all the benefits of telehealth, these are the technological barriers and clinical limitations. First is unequal access to reliable internet and digital devices. In many rural or underserved areas, people might not have access to fast or reliable internet connections or the necessary devices, like smartphones, tablets, or computers. This digital device divided creates barriers for certain populations to access telehealth services, contributing on disparities in healthcare. Rural or underserved populations. These groups are often the most affected by the lack of access to telehealth resources. Rural areas tend to have less infrastructures, meaning fewer healthcare facilities, less internet connectivity, and fewer devices. This leaves people in those areas more reliant on in-person care, which can be costly, inconvenient, and inaccessible due to long distance or other barriers. Integration of telehealth platforms and EHR systems. Healthcare organizations often use electronic health records or EHR to store patient data. Telehealth platforms which provide remote healthcare services may use different technologies. Integrating these platforms with EHR systems is complex because they may not always be compatible. Ensuring these systems work together smoothly is a challenge for healthcare providers looking to provide coordinated and comprehensive care. The fourth one is seamless data exchange. For telehealth to be effective, patient data needs to follow seamlessly between different healthcare systems. If a doctor using one telehealth platforms can't easily access a patient record from another system, it could lead to fragmented care or errors. Efficient data exchange is essential for coordinated care, especially when multiple healthcare providers are involved in treating a patient.